So to just start the panel and give you some of the facts of China, we obviously are looking at a vast country of already a huge aged population. But what's more importantly is that the awareness seems to still fall behind the big numbers we're already facing. We have among the 222 million people over 60, of which if you look at the 65 as the threshold, we have about 140 million. We already have above 40 million who are somewhat dependent or have cognitive impairment. And we also have, in the Chinese terms, people with disability, over 90 million. And more than 1/3 of them have mental disability. So that's also an alarming number. And if we then look at some of the differences between China and a lot of the developed countries, such as the US, Canada, UK, we are actually having a very different generation in terms of our elderly. Unlike the baby boomers in the West, Chinese seniors today have not really possessed most of the wealth of the country. If you look at some of the latest McKinsey studies, 70% of the Chinese wealth is held by the middle income class, and most of them are the children of today's seniors. So if we look at the financial security, for example, of the senior citizens in China, the issues that Chinese seniors face today are really not the same as the ones that Western seniors are facing. And certainly, our financial industry is not as developed as their peers in the West, and especially in terms of financial services that are available to the already aged population. We have more than half of the seniors living in an empty nest, which is contrary to the traditional Chinese value of filial piety. So family members are still supposed to take care of their seniors, but if they are now living far away, they are really not being part of their daily decision-making process, not in their healthcare decision-making, and certainly not in their financial decision-making. And then if we look at some of the latest development in banking or financial services, a lot of that is going online. But today's Chinese seniors are mostly not online, not connected. If you go into any Chinese banks on a regular day, you won't see that many young people. But seniors are still going there, queuing for a long time to just withdraw a small amount of money. So a lot of the challenges we're looking at today in China would be slightly different. Although we don't have very accurate diagnosis number, experts in China tend to agree that we have already close to 10 million dementia patients, and a lot more in early stage of cognitive decline that are not being screened or diagnosed or identified for further help. And we don't have much support network yet to identify people who are suffering from cognitive problems. And I was sitting there almost sweating when Professor Kalawish mentioned how we should shift from the language of talking about stopping elderly abuse, scam, and fraud and exploitation. Because the only thing I could find back home when I accepted to talk here was this national guideline published just 15 months ago by China National Committee on Aging and our Ministry of Public Security, the police. So the only thing the Chinese government seemed to have done is exactly what Professor Kalawich was said we should now move on from. So we are still talking about the most frequently reported fraud cases and tips from the government for seniors to take better care of their own financial situation. I'm not going to go through all the 40 most frequently reported cases, but just some examples. I'm sure they are no different from the ones you see in other countries. And these seniors are not necessarily suffering from cognitive problems, but just because they are aged, they are living alone, and they are not supported enough in making such decisions. They are becoming victims of such scams. So I just picked the top 5, where seniors are asked by people pretending to be community staff or representing a public organization, telling them to be part of a program, a promotion, or a free lunch offering, and end up being robbed, being actually deeply hurt financially by such cases. And that sometimes also involve healthcare, which is in itself another problematic topic in China. And look at the 6 tips from the government. Basically, our government is saying, take better care of yourselves, say no to free lunches, watch out for liars, always double check. What's really interesting, I think, are the last 2. One is consult family members, which I think is one of the things we could facilitate to at least help them stay away from some of the most disastrous losses. And keep learning. Of course, it's easier said than done, but if we look at some of the latest technologies and business models even that we are thinking of developing, it would be really interesting to see how we create new programs to attract seniors to keep learning some of these latest models to better support them financially. So we are not doing much back in China, but hopefully a lot of the ideas I'm getting today, I have got already this morning and will be getting from a lot of you, will be really precious takeaways I could bring back to China and talk to the colleagues in both financial sector and in the aging-related policy making and the research area to work together on, and in return we could really contribute back to this community. So just 2 slides about what Pinetree, my organization, has been trying to do in terms of creating healthcare and wealth care. So one of the the key model of our business or our service offering is to put not institutions but individuals in the center of this network, where we connect all sorts of service providers and stakeholders to rebuild a support network around each senior and their family members. So of course, when they need health care, we are there to coordinate and provide the continuity of care to each senior. But more than healthcare, I'm a strong believer in intervention that focus on the functionality, both physical and mental, of each senior, so that we can delay the really dependent years of their later life. And more importantly, enable and empower their family members so that we are not the only ones concerned about the social health and wealth, the public health and the social wealth of our aging population, but really the family members who are going to play a more important role in keeping our seniors in place, keeping them in good health, and creating a more active aging environment. And one of the things I've been talking about and showing my colleagues at the Global Agenda Council is also the telecare solution we have introduced just a few months ago. We looked at technologies not from the perspective of picking the most cutting-edge, advanced technology, but really making it, as one of our participants, Alfred there said, making it invisible. So we picked one of the low-cost companion robots that was created back in China and used it more as a vehicle to support telecare. And this, what's special about this companion robot-based solution is that it can always involve the family members. So when we talk about families being involved in the decision-making, both in terms of healthcare and in terms of financial decision-making, it should be made really easy for them. So thinking about all the wealth that's possessed by the younger family members of our seniors and how much we are dependent on our mobile phones, we found this solution really easy for family members to get connected to their seniors, whether they are receiving some consultation from the healthcare professionals, or they are thinking about making some decisions, or they are potentially being exposed to financial fraud. Using such tool, we are not just providing telecare. Hopefully with some of the development we could do together, we are supporting a Chinese society that can quest for really the wealth care. Thank you.